How to decompress hip joint and prevent future development of osteoarthritis, which eventually will require hip surgery. That's the subject of our video today, and I will ask our Director of Service, Julia, to help us with the simple set of stretches which allows patient to decompress hip joint between the sessions when therapists work on the patient, or it will help patient as a self-therapy to maintain flexibility of the joint. My name is Dr. Osprochinov. I'm founder of Science Massage Institute located in Phoenix, Arizona, and this short video will give therapists guidance what they will need to ask patient to do between the sessions to support the therapy and deliver stable clinical results with short timetable. And for the patients, what to do in the future as a preventive measure to not spend unnecessary time and money on the therapists, because they can do supportive treatment by themselves in the comfort of their own house. Hip osteoarthritis is degeneration of the cartilage. However, before degeneration of the cartilage and the necessity in surgical intervention, it starts with mild things. Initial tension in the hip joint, restriction in the range of motion, some restriction in flexibility. All of this with the years eventually creates so much pressure within the hip joint that the head of the femur and pelvis start to rub against each other, destroy cartilage, and eventually require hip replacement. So at the early stages, when the tension in the soft tissue actually driving force for the compression within the joint, this tension can be decreased and the elasticity of the tissue restored, and that decompresses the hip joint. So from that perspective, stretches we will show you today is preventive measure for anyone who reaching maybe 40 years, and one time per day doing them, especially if you engage in the physical activity in the gym, will help you to maintain normal function of the joint. Now, there is patient who actually exhibiting pain and he suffer from the limp or from dysfunction and different symptoms. This patient needs to be treated, and it needs to be treated by the therapist. So now that patient needs to do his or her homework, which is 50% of success. This homework consists from the same stretches done between the sessions. In such case, therapist able from session to session going forward, fully decompress the joint while the patient maintains the treatment between the sessions. Finally, the third application. Therapy is done. There is no pain, full range of motion. Patient would like to come back to the normal physical activity. The same stretch is now used one time per day after hot shower as a preventive measure for repetition of the symptoms which may come with time. We will show you 3 stretches, 5 repetitions of each, and each stretch needs to be done during long exhalation through the compressed lips. Inhalation is quick, exhalation is slow. You know, I have older patients, and it's difficult to explain sometimes how you control respiration. I give them very simple visual. Consider that you're blowing balloon for the child. What you will do? You will get a lot of air, right? Full lungs. And then you have small opening and you slowly exhale, blowing balloon. That's the visual for the passive stretch. Each passive stretch needs to be started when the patient starts to exhale and finishes just before he needs to produce new inhalation. That gives you foundation for the each stretch be efficient. I will ask Julia to lay down on her back. Now we will consider that she has tension in the right hip. So she will grab her knee with the left hand, and here is critical moment because gluteal group need to be completely relaxed. So what she is doing, she actually using her hand to fully control position of the knee, so that she is not using her gluteal group to control the knee. Everything from now on done only by the left hand. She inhales, and when she exhales, she brings knee to her shoulder 45 degrees. When she needs air, she slightly releases the pressure and then again brings knee 45 degrees to the same shoulder. It is not this, it is not that, it is this. So 45 degrees. There is little problem for the females because females have wider pelvis. When they do stretch, they actually can compress adductors between the femur and the pubic bone. To avoid that, especially wider pelvis, more chances they will feel very uncomfortable in the groin. So the simple solution is to ask them tie the hand like a stick and put it in the groin using ulnar edge as a compression force. So right now she will grab her knee and she will do same stretch over her hand, and that completely eliminates compression of the soft tissue between femur and the pubic bone. Inhale and exhale. And that's 5 repetitions. That is the compression of the gluteal group. For the second stretch, we will ask Julia to lay on the edge of the table or on the edge of the bed. Half of the glute need to be hanging from the edge of the bed. She will use her arms to control the left knee. Only what she needs to do right now is just to drop her leg hanging from the bed, relax knee and everything. And she just controls her knee, holding that, and let force of gravity stretch iliopsoas and rectus femoris, which control the pressure in the hip from anterior perspective. She needs to do it for maybe 30-40 seconds while she controls the knee, and that let force of gravity to stretch the anterior compartment. If you want to decisively help patients in complex clinical cases, greatly increase your income, and partner with local medical communities, please click right now at the link below in description and join us for live medical massage seminars and webinars, and we will work together. Thank you and see you in the future. Finally, we will ask Julia to sit against the wall or the sofa, and then she will put both feet together and put both hands on the knees. If it's right hip pressure, then she controls the left knee, and while she exhales, she gently put pressure on the right knee in abduction. That is, create pressure and stretch adductors, which control inner pressure within the hip joint. Inhale, exhale. So you see, she put pressure, but she is not putting pressure here, she just counter resists. Now inhale, and again very gently, and she repeat that 5 times as well. So this simple set of stretches, which is done between the sessions and also done as a preventive measure, helps to keep joint health. If there is no complication in the form of, let's say, peripheral neuropathy, what also helpful to decompress the hip joint is correct application of inversion table. That is additional tool which allows to decompress both hip joints. We'll discuss correct application of the inversion table in the separate video in the future, that you know how to suggest that for the patients, because in majority cases it's done incorrect. Thank you, Julia, for your help, and thank you everyone for watching this short video, and I hope that you can use that for your future patients. And if you have any comments, please leave them in the section below and we can have productive intellectual discussion. I hope you enjoyed this video, and let's work together to bring your practice to the new level of medical massage expertise for the clinical benefits of the patient. Thank you very much. See you in the future.